Do you ever leave the doctor's office feeling like you have no idea what that visit is about to cost you? In an effort to be transparent with medical costs, local hospitals have put prices online. But as major federal regulations on costs draw near, a Cleveland research group says so far the price listings don't help you, the patient.
5 on Your Side investigator Jonathan Walsh reveals the costs, the concerns, and a potential solution.
In December of last year, 69-year-old Howard Barksdale from Bedford was just driving down the road, but then got rear-ended.
It's like contusion of being hit. My neck was jarred.
He says the doctor then asked him to get a CT scan.
It's like with anything, you always want to know the price of it. I don't know why that would be different.
He didn't know the cost. $50 shy of $4,000.
There should be some kind of a clear explanation of what the bill is going to be and how it's going to be handled.
Hospital systems have posted prices in the past for common procedures and lab tests. They list them on their sites. But
prices drive that cost, and that transparency is not really an effective tool.
Lauren Anthus is from the Center for Community Solutions in Cleveland. Just recently, it analyzed health costs in Northeast Ohio. It found list prices for having a baby, for example, varied from $3,000 at one facility to $41,000 at another. But even then,
usually list prices don't reflect what's actually paid. It's a matter of negotiation, almost on a case-by-case basis.
Your case is based on all kinds of factors. Your insurance, public or private, your deductible, how much you pay there, your policy, the details inside of that. So by the time you go back and forth, you are right in the middle with a price that is drastically different than what's listed.
And we need to fix our system.
In June, President Trump signed an executive order forcing hospital systems to be more transparent about pricing by January 1st of 2021. Now they have to post various charges, including the highest and lowest negotiated prices with insurance companies.
The consumer public is demanding transparency on all kinds of levels.
Senator Nikki Antonio from Lakewood serves on the Ohio Senate's Health and Human Services Committee. While the Centers for Medicare and Medicaid Services, or CMS, will monitor complaints if hospitals don't comply, Senator Antonio says on a state level, the legislature could end up educating providers and patients about these new federal regulations.
That provision of care has to be the guiding principle. The care first, the financing of that care second.
We asked the big three hospitals in our area if they see a need to do more with price transparency. The day after our request, University Hospitals unveiled its new UH Hospitals Price Estimator tool.
It connects the provider, the patient, and the payer to look at specific information.
The free online service asks for numerous things: your insurance company, policy number, name, birth date, and so forth. Then you can search for specific lab tests or procedures. It will then calculate your out-of-pocket costs, taking into consideration things like deductibles, copays, and coinsurance.
Part of this is just doing the right thing for the patient, right? Empowering them with information so they can make informed decisions about their care.
For patients like Howard, who on that December day was just driving to see his longtime girlfriend in the hospital, well, they say they need all the help that they can get.
It'll let you know what you can afford and what you can't afford. You just don't go out and buy a $1 million house when you know you can't afford it.
I'm 5 on Your Side investigator Jonathan Walsh.
And we have a link to the University Hospital's price estimator and Cleveland Clinic's complete response to our questions on our News 5 app. Metro Health did not respond to our questions.
It is